When I started out in my career, we had limited options. And now that we do have some more dedicated treatments that are available, it's opened up a whole lot of new possibilities for patients who are experiencing these problems so they can go on to live healthy and successful lives.
What is tardive dyskinesia?
It's a neurologic condition. That means that it affects the nervous system, characterized by abnormal involuntary movements that is caused by certain medications that belong to the class of drugs called neuroleptics or dopamine blockers.
As psychiatrists, our job is primarily, at least in the United States, to prescribe medication. And so oftentimes it's the medications that we've prescribed that cause TD for our own patients.
It's not a disease that leads to death, but can lead to disability. Up until a few years ago, tardive dyskinesia was considered an unfortunate event for which there was very little we could offer, which is not true right now.
So then what is the typical treatment plan for tardive dyskinesia?
So the first, I think, step is understanding sort of all the different kinds of movements and which ones are most bothersome to the patient.
Identify the offending agent. Try to slowly taper off that medication if able. If not able, then we want to try to replace that medication with a lower potency antipsychotic or neuroleptic. If we are not able to do that because it will compromise the psychiatric status, then we treat with agents that are specifically designed to treat TD.
Depending on the type of movement, we might consider botulinum toxin injections to control some of the involuntary spasms and movements.
The FDA has approved 2 drugs which are quite effective. They're called deutetrabenazine and valbenazine. And those are 2 drugs that are in general quite well tolerated and can be oftentimes used together with the antipsychotic drugs. So there is no conflict or no negative interactions. The more severe forms often do not respond to treatment, in which case there is a form of surgery which is called deep brain stimulation.
DBS is a surgical procedure that we usually liken to a pacemaker. The electrode that is usually implanted in the heart for a pacemaker is implanted in the brain instead.
And so when you're working on a treatment plan with the TD patient, how similar or different is it from the neurologist, or do they complement each other?
Oh, they're absolutely complementary. Usually, though, it's the psychiatrist who's prescribing the medication that's causing the TD, so then it falls to us to make adjustments after we get their input.
How do you measure success when it comes to treating someone with TD?
We can do certain kind of movements, certain kind of tests, but most importantly is the way a person perceives and navigates her life or his life.
If you catch it early enough, it is reversible. So there is definitely hope for people who've had TD for years or even decades. If they haven't tried these new medications, they should definitely reach out to somebody.